Hi, welcome back. Today we are going to be talking about how to be an informed consumer of the nutritional studies and the science on nutrition. When I first began this research 10 years ago, I was so confused by all the conflicting messages out there. I burned through so many books by different authors and different doctors and different experts, and so many times they would just have conflicting information that completely were at odds with each other, and it made no sense to me. The same thing is happening to even more of an extreme today. Let's talk about why. So, back in the 50s, 60s, 70s, when it was becoming more apparent that cigarette smoke really was bad for you and would give you cancer, the tobacco industry put out a huge mass marketing campaign to confuse the public so that they were getting conflicting messages and they wouldn't quite know who to trust. And the same thing is happening today. So, in today's world, you can pay researchers that will produce a study for you that shows exactly what you want it to say. And a lot of times in the media, or when we hear about studies from friends or from sources that we're not sure about, we don't have the information we need to say, is this a good study? Was it done properly? And it can be really, really confusing. So here are some things I've learned over the course of my trying to figure all this out to help you get the right information from the right sources. So this is kind of my quality checklist that when I hear about a study or am looking at a study to help me know if the information is correct and the study was done properly. So the first question you ask is, who funded the study? Because if the dairy industry is funding a study to show that dairy is good for you, you can see that that's a major red flag. You want the studies to be done by independent sources that don't have a stock in how, that they don't have something to lose or gain based on the outcome of the study. Then the other question I ask is, how long did the study last? You can get a good result for a short period of time for a lot of things that you test. And so just having a study go for a few weeks or a few months isn't going to really give you the information you need to know if something is healthy or not. I like to look at studies that have at least been conducted for a year, but preferably 10, 20, 30, 40 years. They do exist to show that how is this thing they're testing going to affect my health in the long run? Because as we all know, there are tons of fad diets out there and ways to eat that are popular and trendy that probably are not healthy in the long run and not sustainable. So whenever I'm getting information about how something will impact my health, I want to see it from the long view. Who is included in the study? How many people, your sample size, the types of underlying health conditions that they had, all these things will impact the outcome of your study and are good to know about. And then words like double-blind, placebo-based, and control groups are all good words when you are learning about a study. So double-blind just means that the people administering the test and the people receiving the test, no one on that end knows what they are getting or what they are giving if they're the ones administering the test. And an outside group that's observing are the ones that know. And then placebo-based just means that there's an exact replica of the thing that they're testing that looks just like it and tastes just like it, but isn't it. So they can test and see if what they're testing actually works. Control groups are really helpful because a lot of times they'll do a study, but they won't compare it to a group of people who didn't experience what they're trying to test. And so they can be like, yes, we saw these outcomes, but we didn't test it against people who did nothing to see how much the thing that we're studying really had an impact. So these kind of words help me to know that the study was done properly if those were included in how the study was conducted. Now, as a busy mom of 4 boys, I do not have time to sit and pore over every little study and see how it was conducted and look through all the paperwork to figure it out. Although I am interested in that and I really love well-organized studies that give good information, I just don't have the time to do that right now. So, in the course of these 10 years of looking at this information, I have found some doctors and some resources that I know care about well organized and properly done studies, and they give me the information that I need. So these are kind of like my cheat sheet, quick guide doctors and committees that I look to when I need information on a certain topic, because that is what they do for their jobs. So Dr. Michael Greger has the website nutritionfacts.org, and you can also look up nutrition facts on YouTube and type in any subject you're interested in nutrition wise, and there have been studies on it and he has reviewed them. Sometimes with like complete series dedicated to them. He has a series on circadian rhythms, cardiovascular health, the keto diet, the paleo diet, exercise, and certain foods and the nutrients you get from them. I mean, just a huge database of what the science is saying, and I just feel that he is a very trusted source. Dr. Pamela Popper runs an organization called the Wellness Forum, and she is a total research junkie. And every Tuesday and Thursday on her YouTube channel, she reads the latest studies and what their findings are. And she's not dissuaded by what's popular or, or what the fads are. She just only looks at the science. Anything that the Esselstyn family puts out, I know has been backed by years and years and years of research and study, so their information is always really good. And then Dr. Neil Barnard, he is the president of the Physicians Committee for Responsible Medicine, and they have a podcast and a YouTube channel and a website, and the information and research they conduct is a trusted source that I turn to as well. So, in closing, it's very important that you are an educated consumer and that you don't just be blown about by whatever conflicting studies or, oh, now they say this, and oh, now they say that. It's so exhausting. So step out of the rat race and focus on a few doctors and nutritionists and researchers that you can trust, and be knowledgeable when you look at the research. And that will help you going forward to know that you're getting good information. Okay, have a great day, and we'll see you